Hello, I'm Elizabeth Koff, Managing Director of Telstra Health, and I'd like to welcome you to our conversation with Matt Bardsley, the Chief Executive of MedicalDirector. Welcome, Matt.
Thanks, Elizabeth.
Before I start though, most importantly, I'd like to acknowledge the traditional owners of the land on which we are located today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging. It's been quite a year for everybody in health, or quite frankly, quite a couple of 2 years for everybody in health with COVID. And MedicalDirector's been on an extraordinary journey through that period, both through COVID and then working with Telstra Health. So really I'd like to start by asking you, Matt, tell us a little bit about the journey of MedicalDirector pre-Telstra Health.
Yeah, so thanks Elizabeth, and I can only imagine we were a small part of that COVID journey, and your role previously as well had, obviously a lot of burden was taken on your shoulders for that COVID response. So big thank you to you and the team of New South Wales Health to help support us through that. Yeah, so at MedicalDirector we are obviously part of that journey as well, and so a couple of years ago we recognised that a lot of the outbreaks were happening in general practice, and we had a phone call from the Minister's office back then to say, what can you do to help us with that? And I was so proud of the organisation and the team at MedicalDirector, where they jumped straight to the challenge and we deployed telemedicine across all of our customer base within 10 days. That's unheard of. And it was just an amazing response from the team. So super proud of everything that they did through that time. Obviously, throughout that whole couple of years, so many changes coming so quickly to general practice. So our team were feverishly from their kitchen tables and lounge rooms and spare bedrooms, working as hard as they could and as diligently as they could to do our bit in supporting the response to COVID. So look, it's been an epic journey from that perspective. And then during all of that, we also embarked on finding our next partner for MedicalDirector. And obviously we were previously owned by a private equity organisation, and so inevitably they always end up needing to sell their asset forward. And we engaged with a market sounding, and Telstra Health came forward, and that excited me a lot, Elizabeth, because I think there is absolute understanding that an Australian-owned organisation that owns us will do nothing but be a net positive to the outcome of what we need to achieve at MedicalDirector. And all of the assets that Telstra Health already have in its portfolio, we recognise that MedicalDirector could be and do so much more with them as well.
Becoming part of Telstra Health represents a new move for MedicalDirector, and Telstra Health actually is a wholly owned subsidiary of Telstra, which is the major communications provider here in Australia and has services internationally. What do you see were the main benefits or potential synergies that could be derived for being part of Telstra Health?
Yeah, really good question, Elizabeth. There were so many exciting opportunities with the Telstra acquisition, strengthening ourselves in many aspects. So if I talk about a couple of those points, so first of all, our customer care and our ability to service our customers. Obviously, Telstra and Telstra Health have got a great knowledge and understanding of how to improve call centres and how to really strengthen those areas. The other one was around the security side of things. Obviously, having the largest telecommunications organisation and then also Telstra Health behind us, it's lifted the bar in terms of what we need to think about with our own internal processes around how we continue to improve the security of the systems that we write. So another great example of how that has really improved the outcomes. And then finally, it was the clinical support. We have amazing clinical capabilities in the organisation, but then broadening that into the broader Telstra Health portfolio brings a whole suite of clinical insights that can be augmented with the ones that we have within our general practice focus. So we see a strengthening across the clinical delivery as well within MedicalDirector. So I think those three things were the exciting ones. And then what we spoke about before, Elizabeth, just all of those opportunities that we can now all get after to improve the health outcomes of Australians with all of that strength behind us can be nothing but a net gain for everyone.
That's great to hear, and part of a connected system. So that's another benefit. Thanks, Matt.
No worries.
And we're delighted to have you as part of the Telstra Health family. And I think as we move Telstra Health forward, we're really looking at delivering digital solutions across the continuum of care, because we've got cancer screening registers, we've got primary health care, we've got pharmacy solution with Fred IT, we've got hospital solution, aged care solution, and costing solutions to support the hospital services. So I guess I'd be interested in teasing out a little bit, where do you think the obvious synergies are with Telstra Health and MedicalDirector?
Yeah, fantastic. So obviously, you're right. The one thing about general practice is it's at the epicenter of a lot of what we just spoke about. You know, they are the primary care community, so they have the patients coming back to the practice normally when they've engaged in some of those services that you spoke about. So we see great opportunity, and we're already doing some amazing things. So already within the year, we've managed to integrate the National Cancer Screening Register more tightly with MedicalDirector to be able to provide that insight for the patient into the doctor's record as well. We're ERX with Fred. One of the other things we did...
That's the electronic script.
Sorry,
yes,
thank you. Thanks. Yeah, the electronic scripts, we've integrated over the pandemic period again to provide that true electronic script. Once the legislation had passed, we were able to then create those electronic scripts and have them start to transfer to support telemedicine, so that there was a lower touch for the community care that needed to go on. So we've got ERX already more tightly integrated. We've got that National Cancer Screening Register, and obviously aged care and disability. We have a lot of our customers service those facilities, and they walk in and out of those facilities on a regular basis. So again, our ability to now better align our solutions and create more interoperability between them is really exciting. And then obviously the future is to do more and more of those things to support more and more types of care out there.
No, that sounds terrific, and that's where our vision is, to take Telstra Health, so you're part of that vision in delivery. I guess the thing that's getting a lot of media coverage at the moment and high on people's minds, the state of primary care, and in particular general practice across the country. If general practice really is the cornerstone of healthcare in Australia, and we do need some reform in healthcare policy and funding, where do you see MedicalDirector could play a role in assisting some of that primary care reform?
Yeah, fantastic. So I think the key thing is we're an enabler. We are here to support the changes that need to be brought to the services within that community. We can see from our customers, and we hear from our customers, they're exhausted from a very, very heavy workload over the last couple of years. And again, a huge thank you to all of the people that have put their shoulders into that pandemic response, and it's been fantastic. But there's clearly, an exhaustion in general practice that everyone is acutely aware of. So anything we can do with technology that can take some of that burden away is something that we want to continue to invest in and continue to support. As well as that, as styles of care change and maybe more allied health and more nursing facilities come into general practice, how do we support those additional services so that we can keep that continuity of care happening? So creating tools to help streamline care planning, and also create insight into how the practice is operating. Where should the practices be focused, in their efficiency gains that they need? Mental health is on the rise, tools to be able to support mental health. All of those things are where we're looking, and all feedback from our customers who are saying these are the areas that they're feeling within general practice. And also the mobility and agility of general practice as well, allowing people to operate different models. So using cloud solutions such as Helix, it allows you to liberate yourself from the practice and be a bit more free. And we've got some amazing stories of organisations that are using that new capability to come up with different models of care.
What does the capability of the cloud solution actually look like? Because for non-IT people, the cloud is a mysterious thing that exists up in the atmosphere.
Yeah.
But it does actually deliver timely responses to many aspects of care. So I was interested in your perspectives there.
Yeah, thanks, Elizabeth. So the fundamental thing is that centralisation of all of the infrastructure. So obviously in general practice today, we support many of those general practices with their facilities. With cloud, you get to centralise a lot of those pieces, so you can create efficiency and scale through that. And what it does is it allows the system to be available all the time, whether you're sitting at home, put your kids to bed, and then come back to the lounge and have a look at your pathology that's come in for the day. It brings the practice closer to you and integrates into your life a lot better. So what we hear from our customers is being able to integrate things that we take for granted, being able to integrate some more of that into your life is valuable. The other one is the fact that it is cloud and is connected. You can be more mobile. You can be in community. So we've got some organisations that are using it with nurses out in the field, and that information flows back into the general practice. So many efficiencies that can be gained from cloud, and they're just the beginnings. The other key thing is obviously with cyber security, and that overall threat, and that threat continuing to strengthen in some ways. We see the cloud as being a great ability for people to put their information safely. And again, now with Telstra Health and Telstra, supporting the organisation, we continue to see that strengthen.
So GPs can become digital nomads.
Yeah. Well,
as the term often is described.
So you combine that with telemedicine and the electronic scripts, and we've got situations where doctors in the pandemic, they wanted to reduce their exposure to society during that very risky phase, but wanted to continue to provide that care. Well, our Helix customers could very simply just be at home, send an electronic, do a telemedicine consult, send an electronic script, all seamlessly, as if they were working from their practice.
Yes, it's extraordinary because so many other industries have made the digital transformation, and health still struggles just a little bit. But we're there to help fix that. The Australian opportunity you've described very eloquently. But what about further afield in the UK and the NHS? Because they're grappling with the same issues that every other health system is around the world. And what do you think the opportunities are there for MD? Yeah,
look, we're very excited about the opportunity with the NHS. They have very similar, as you said, Elizabeth, very similar issues. Scale is much larger. Obviously, NHS is the largest individual health service in the world, and so when they go to deal with problems, they deal with them on a very big scale. And so they went and looked globally for platforms that could solve some of these problems and be the base foundation for the next evolution in healthcare. And that's when they found MedicalDirector. So a few years ago, we were awarded onto the framework over there to be able to provide our solutions into the UK. And we've been working with the government and NHS Digital and NHS over there to bring the cloud solution and everything that we just spoke about into that market. So very exciting opportunity, and we've already deployed our vaccination app to help support the vaccine program through that time, and now we're working on bringing the whole cloud system into place. And what's exciting about that is it allows us a bigger market that we are servicing, so it allows us to do things on a bigger scale, so we can bring more capability into the platform at a faster rate. So I think for our customers here in Australia, that is actually a really positive thing as well, because it allows us to get after things quicker. And again, with the support now of Telstra Health and yourself, Elizabeth, and the team, we're feeling that acceleration to be able to get after all of the things we need to get after.
No, it's an extraordinary opportunity. And if anything, I think Medical Director can be rightly proud that the NHS did a search and found that was a solution that really spelt out a future roadmap for their primary care services in the UK. It is a big market,
Yes.
and it is tough to break in, but I think with your enthusiasm and passion of how Medical Director is delivered, I'm confident you'll be a success over there. And Telstra Health is there to support you in every way that it can.
Yeah, fantastic. And I just want to say it's a team of amazing people that have achieved everything we've spoken about today. So I just want to do a big shout out to all of the Medical Director crew, because I sit here today talking to you, Elizabeth, but it's the successes of all of those people that allow me to sit here. So the pandemic response, all of the progress we made through those digital enablements of electronic scripts, the servicing of our customers, being there for them through those hard times. It's those great people at Medical Director that have done that. So big thank you to all of the crew from Medical Director too.
Thank you, Matt.
Yeah.
And we will partner to have a successful Medical Director across Australia, and the world is our oyster. With the NHS, the next step on the agenda. But thank you very much for your time. It was wonderful speaking to you and gaining your insights on Medical Director. Thank you.
Thanks, Elizabeth.